Abby Horton. I teach at the Capstone College of Nursing as an assistant professor. I am a registered nurse, a certified health and life coach, a Alabama ambassador for the nursing college, and one of the wellness class educators. You can reach me at abby.horton at ua.edu if you want to connect after the class. So one of the popular questions is, will the slides be available? And Miranda will pop those in the chat once we get kind of toward the end of our time together today. So a couple of things that we like to talk about with this class is common health concerns that you have as you start to age, discuss important health screenings that might be helpful for you after the age of 40, talk about some useful strategies for effective weight loss and health management, and then identify ways to stay fit for individuals who are over the age of 40. If y'all have other things, when I get into this mode, it's a little bit more difficult for me to see the chat. So if there are other things that y'all want to talk about or questions or things that come up, feel free to put them in the chat and Miranda can jump in and tell me, hey, this is a question or this is a topic that we want to see. So after the age of 40, you typically start to see just like the everyday wear and tear. We talked about everyday aches and pains recently in another really popular class of mine. And it's just because once we get to the age of 40, our hormones start to shift. Our workload often shifts. We start to sometimes lose muscle mass and bone density. Our hormones change, and just, things become a little bit more challenging. That's not always the case, but that's pretty typical. And part of it is that our body compensates really well when we're younger. And then we get to midlife and we start realizing, okay, we can't compensate quite as much as we used to. I just turned 40 last month. I've been talking about it for a while when I teach this class because this class always was bringing it to the forefront that I was getting closer to 40 than not. And I definitely am noticing some changes. Really, changes start even in your late 20s, early 30s, but by 40, you kind of start getting to the point where you can't ignore it anymore, right? Um, you're having more, painful days than not, or you're having more weakness when you go to lift the laundry basket or, pick up something heavy at home. And so your 40s really can be a turning point for many people. A lot of the things that I'm doing today when I talk to you about these examples, they might be exaggerations or generalizations, but I think it's probably true for most people, the things I'm sharing. Our metabolism typically starts to slow, our hormones shift in ways that they haven't really since puberty. And then our recovery changes, right? So there are all of those like memes on social media about, oh my goodness, I slept on my pillow wrong and now my neck hurts. Well, that really is a lot of our reality sometimes. And so prevention and health maintenance become really, really key. And when I updated the slides this year, I included these 40 birthday balloon image because I love a balloon. I feel like it's not a party without a balloon. And I didn't realize until someone mentioned it to me. They're like, Abby, you have balloons and everything. And I was like, yes, it's not a party without a balloon. And I do think that midlife can be a party, can be fun, but sometimes, like the balloons, we have to bring them ourselves. Sometimes it's not that it's inherently fun, we have to make it fun. So there are 5 pillars of healthy aging. It's physical activity, and Miranda just went over a lot of the ways that you can start to do a movement on campus, at work, a healthy diet. So not just that, it's healthy nutrition, really, not that you're on a diet, but that you're tracking your macros. Your your healthy fats, your fiber, your protein, your, full fiber carbohydrates, all of those are your complex carbs. And so you have a healthy nutrition, you have good quality sleep, which sleep is one of the hardest things to impact, but it is the most important in terms of like being foundational to your overall health. Brain stimulation. So the mindfulness and meditation that Sierra will be doing with you guys in May. Word uh, puzzles or crosswords or Sudoku, reading, learning, trying something new or novel for the first time in a long time. Relationships and purpose, having connections, staying engaged, having meaning and purpose and happiness in your life. Those are all really important keys. And then I added a few things as well. So not just sleep, but sleep and recovery. So looking at, I call them the S's, the strength, the stamina, and being able to actually stretch and move your body. So that's really important. Can you stretch? Do you have stamina? um are you able to really take care of your health really well in that way? And then habits and mindset. Habits are so important and so essential to being able to change anything about your life. Nothing really changes until you change your identity and you change your habits. So, the example that I like to give is before you ever start to run a 5K or a 10K or a marathon, before you ever become a runner, in your mind, you have to become a runner. You have to think like a runner. You have to plan like a runner. You have to put your workout clothes and your running shoes out like a runner, right? And so in your mind, your identity, you have to identify as a runner. So you don't say it as if, oh, well, I'm thinking about running. If you've ever met someone who likes to run, they're like, oh, I'm a runner. And that's one of the first things that they tell you about themselves. Is really funny. They're like, oh, I'm a runner. And then like tell you their, personal records, which they call PRs, and they tell you their favorite running shoe. And like they have all these rituals and routines. Like, I don't know of anyone that does the habit formation and the identity formation around like a good wellness practice more, in depth or better than a group of runners, which really transfers over to other parts of their lives, right? And then hormonal and metabolic health, because a lot of what we do in midlife, we're building the muscle that we're going to need for our 60s, our 70s, our 80s, and beyond. And in your 40s, because of the actual hormonal process that goes on with our estrogen, our testosterone, our progesterone, all of those good hormones, because of the ratio of that, because of how they're made, the 40s is one of the last times where you have everything kind of on board to be able to build those muscles really well. It doesn't mean that you can't in your 50s, 60s, and beyond. It just means that your 40s is where you really have a lot of, things working in your favor to build good muscle. And so that's really helpful because muscle is very protective for longevity. So increasing your health span for how long you can be healthy, not just your lifespan. For the last 10 years or so, research has shown that you stay pretty unhealthy and that your activities of daily living, so cooking for yourself, tying your tennis shoes, being able to go to the restroom unassisted, and like all of your health and wellness things that you have to be able to do to stay at home gets really impacted those last 10 years of your life. And so things like falls, falls are listed as the number one reason other than not being able to complete your activities of daily living, which we abbreviate ADLs in healthcare. Those are the two reasons why people aren't able to stay at home independently and need to go to an assisted living or a skilled nursing facility, which in the US we typically call a nursing home, because they aren't able to actually walk safely without falls or do their activities of daily living. So all of these things together on this one slide is really key for you to be able to kind of map out a plan, right? And I think it's also really important to think about if you're not going to be able to be independent, because many people aren't at some point in their life, what that would look like. And so the more you can do some of these preventative steps, the less likely you would need assisted living or skilled nursing, or it shortens the time span that you would actually need it. So I'm walking through that right now in midlife. I'm 40. I have 5 teenagers and aging parents who are starting to need more assistance, not just physically, but with errands and financials and decision making and things like that. My parents are in their mid 70s. And so I am right smack in the middle of what midlife looks like for, someone who's in what we call the sandwich generation. And so Dr. Brene Brown, the social work professor out of Texas, she's very popular, has lots of books and a viral TED Talk, and was one of the OG TED Talk viral sensations. She writes about midlife. She says, it seems as if we spend the first half of our lives shutting down feelings to stop the hurt, and the second half trying to open everything back up to heal the hurt. Midlife is not a crisis, midlife is an unraveling. And what I would say about that is there is a lot of mental health and emotional and spiritual components to midlife. It's not just that you're helping kids fill out, graduation forms, which we're doing this week for my oldest, or we're helping, our parents with their caregiving needs. But it's also that we have a lot of responsibility at work. It's also that we're reaching midlife and realizing, okay, we're not going to live forever. You start to reflect on the future and the past. And so there's just a lot going on, and that can feel like crisis. It can feel like unraveling in a good way. It can feel like unraveling in a chaotic way, but it also can be this opportunity. So, some folks who really want to positively, like heavily positively reframe midlife is talking about it as a chrysalis. And a chrysalis, if you love butterflies like me, a chrysalis is where the caterpillar goes to become the butterfly, right? And has this amazing transformation. I love butterflies and always have. And so I love a good analogy or metaphor about that. And people love to talk about personal development in midlife as this transformation. And so instead of being in a crisis, some folks are starting to say, no, you're really in a chrysalis where everything feels like it's kind of, falling apart and melting down and just unraveling, and you don't know what it looks like. But then at the end, it allows that butterfly to go from this, caterpillar in crisis to this beautiful butterfly that we see, and to kind of really respect that. And so this is what Brene is really talking about. So whether you're in midlife, approaching midlife, or maybe you're past midlife, I think it's always important to kind of consider how you can pause, reflect, and reset, because particularly at the end of a hard season, the end of a semester, we have a lot going on in our world right now. I think it's really easy to get kind of bogged down in that, have a lot of noise, a lot of overwhelm. And then if you add anything else onto it, like your health or, these kinds of, midlife topics we're chatting about today, can feel really, really hard. So, some common health concerns that you think about over the age of 40, it's everything from chronic pain to joint health to bone health, so osteoporosis, stress, acute and chronic usually, but it could be or depression, anxiety, other mental health concerns. Certainly, our heart health starts to become more of an issue for many people, in the form of blood pressure, cholesterol, triglycerides. You can see a change in your resting heart rate. Inflammation is going to be huge at midlife because so much of what we eat today in the standard American diet, SAD, or the modern American diet, MAD, are really inflammatory foods. They're heavily processed foods. And so we've got those issues. You've got communicable diseases as we age. Some things that we're more likely to get are things like the flu, pneumonia. Um, we can get things like shingles or now COVID-19. So those are four that you're going to be most at risk for as you start to age because our immune system changes. So we get to the point where our immune system's responses start to change as we age and aren't as resilient sometimes as they were before. Again, it's probably likely because of, low movement, that sedentary lifestyle, lots of inflammation on board, lots of caffeine and sugar, not enough water, not enough good sleep. So it's not that it's, just a fact of life that, you're going to have these issues. It's more of your body can't compensate given the fact that we aren't doing those healthy lifestyle behaviors that we know that we should do, but are really simple but hard to do sometimes. Things like your blood sugar start to, get a little haywire. You can have a lot of sugar spikes. And so if your blood sugar is kind of doing this all day long, that can even cause a physiologically induced, meaning your body causes you to have anxiety because your blood sugar is doing this all day. Your body mass index, which is not the gold standard for me. It's not the end all be all, but it is a metric we look at. That definitely can fluctuate, especially for women and men, really. Around the midsection, you can start to have extra pounds. And so it gets more difficult for you to kind of lose that protuberant belly or that belly that extends over your abdominal waistline, and you become more at risk for cancers and other skin conditions, but cancers overall, particularly skin cancer. So if you haven't scheduled a check with your dermatologist, or if you don't have a dermatologist, going and having an annual exam with a dermatologist to make sure that you don't have any moles or lesions or things on your body that could be cancerous. There are a few types of cancer that you can most commonly have: basal or squamous cell carcinoma or melanoma, which we know melanoma is the one that tends to have poor health outcomes. But many are treatable if caught early. Changes in your hearing and your visual acuity. This is natural aging, wear and tear, but also hormonal changes or fluctuations do influence your vision and your hearing. I will say, though, about your visual acuity, make sure that you're wearing something like blue light blocking glasses, like I have on today, or your readers or things that you're supposed to wear, because we spend a lot of times on our cell phones or in front of a screen. um, that is really fatiguing to your eyes. So if you see that blue light bouncing off, you can probably see it reflected. That blue light is on my camera to make me light up, but that blue light can be really harmful to our eyes because it goes into our retina, and when we look at blue light all day long, it naturally stimulates our body to think that we're outside in the sun. And so if we do that all day long, then our body doesn't get the natural cue from the light coming into our eyes that it's time to start to wind down. So when it starts to get dark outside, that's when we need to make sure that we particularly have our blue light blocking glasses on, or that we're just not engaging in activities where you would have blue light, like a computer screen, a phone screen, some TV screens, some light bulbs. Making sure that you actually, if it's dark outside, that it's pretty dark in your house. So at the Horton house, when it gets dark outside, we don't have any overhead lights on in our house any longer. It's just lamps only. Um, and that helps keep us in a good, what we call circadian rhythm, meaning that that's our body's natural rhythm. Another good rule of thumb is that if it's dark outside, we're not eating a lot, we're not moving a lot, we're not exercising, because our bodies are designed to kind of unwind when it is dark outside. And so it's good if you're able to, eat the most heavy meals during the day, earlier in the day. So more like a heavy breakfast, a medium lunch, a light dinner, and usually Americans flip it, and we have a light to no breakfast, probably a medium to heavy lunch, and then a big dinner. Flipping that when you're in midlife can be really helpful. It also helps you be able to metabolize your food and not have food sitting in your belly, because when you're going to sleep, if you eat something really heavy close to bedtime, then the blood that is needed around the rest of your body to put you to sleep and to heal and restore your body is going to your gut, is going to your belly and your intestines to get rid of that food. So one or two things happen. Either that blood gets diverted and you don't get good restful sleep and good recovery, or that food doesn't get broken down. And depending on your own body type, that's gonna, make the difference, right? Like one person would maybe use the blood in a different way versus the other, and the energy that's consumed with that. So I would say if you have, changes with your gut motility, your hearing, your visual acuity, don't assume that that's not reversible. When I started wearing my blue light blocking glasses again, I realized I had had a lot more computer work, and that was causing me to have a lot of eye strain. And so once I stopped having so much eye strain, I was able to actually not need my glasses as much, my readers as much. My vision wasn't actually worsening because it was worsening because I wasn't treating my eyes well. And so, one rule of thumb is to look up every 20 minutes for 20 seconds, 20 feet away. And that can really be helpful along with wearing the glasses. Hearing does change. It can change for men, because of their testosterone levels fluctuating. It changes for women because our estrogen and our progesterone will fluctuate, especially around, perimenopause, menopause, postmenopause. And then, of course, you do have age-related changes that occur. Some of those are heavily, tied to genetics. And so it's important to understand that, especially women who are going through perimenopause and menopause symptoms, a lot of times they'll have itching ears, or will have ears that feel really wet or just uncomfortable, or a lot of popping in their ears. And that is a little known fact that is actually related to the hormonal changes in your body. And so, if you feel like there's a pulling, itching, wet sensation in your ears, especially if you're female, it may be that you have an ear infection or fluid on your ears, or it could be hormonally related. So don't kind of overlook that. Make sure you let your medical doctor or provider know that. Um, Sexual health changes, of course, because of our hormones changing. We can have a lot of issues with dryness, with libido changes, with just a lot of fatigue and just loss of interest and things like that. And so that's also important to talk to your healthcare provider. And sometimes these changes are so gradual that you don't realize that it's a new problem for you. So things like they're calling them, they're what we would have called a suppository before. They're calling inserts now. And so instead of calling it a vaginal suppository, for example, they're calling them a vaginal insert. And so if you are having pain, if you're having even pelvic pain, can be caused because of sexual health issues related to hormones. Um, with or without talking about, actually having sexual intercourse, because you are meant to have, tissue that is, moist, and that, is plump and full and not dehydrated. You can even have pelvic pain and stomach pain and back pain from those kinds of issues. And so they do make vaginal inserts for women to help with that. For men, usually they look at testosterone to see if there's low T. Y'all have seen the commercials on TV. A lot of times they like to give men pellets that can go under the skin. Women can get those as well. They also have creams, and they have injections that you can take. And so there are lots of ways to kind of talk about that. And it's not just because, you're not able to actually do the act, it actually impacts other aspects of your life. And so pelvic pain is a huge one, and men can experience that too. And then just other lifestyle changes, like I mentioned. And then, of course, mental health. When you have all of these things going on and you have a lot on your plate, you may have children, you may have parents, you may have a lot of work responsibilities, because your 40s seem to be when you start to get more and more responsibilities at work. It's just kind of this pressure cooker moment sometimes. And you need a release valve on that pressure cooker, right? Every good pressure cooker needs a good release valve. And the more pressure, the more you have to really monitor that release valve. It's the same thing with humans too. We're not cookware or robots, but we need a release valve. And so one of the things that I'm really looking at as I'm kind of navigating this season alongside you guys is kind of the the mental health aspect of, taking care of myself, journaling, counseling, good friends and connections. That's a pillar of good health. All of this preventative screening and healthcare prevention, that's another good pillar. And then a third kind of surprising pillar is really just self-care and hobbies. And self-care isn't chocolate and bath bombs. Self-care can be boundaries and saying no. I prefer bath bombs and chocolate to saying no and healthy boundaries. But in all seriousness, it's hard, right? It's hard to have good self-care. There's also kind of this notion of doing hobbies. People on social media have declared this the year of the analog, which was just the 90s. It was the best part of the 90s, right? Of being off your phone, not having it within reach like we all do, and, knitting or crocheting or playing golf or gardening, or, what we would call piddling, around the house, right? Or puttering around the house. Those kinds of things, having real hobbies. And so a researcher that I have recently followed out of Emory University over in Georgia, is talking about having hobbies, and talking about having lots of different hobbies. And so that can be really strongly correlated or connected to having good health, good lifespan, good health span, and a lot of happiness. And so think about that too. Self care and hobbies usually don't make the list of life changing things, but I think we're starting to understand and even starting to see research on it really matters. It matters as much as going and getting your blood sugar checked. So, with that being said, we would love to see you at a Wellbama screening. If I had to bet, I would bet that most of you probably do go to Wellbama screenings because we have a really great, tight knit community. But maybe try to think about a colleague or somebody you work with or somebody that you see on campus. Maybe we start a revolution today and just ask, hey, have you gone and gotten your Wellbama screening? Especially for those of you, if you're faculty who are on the call, faculty engagement with Wellbeing would be amazing to get those numbers up. So maybe reach out to someone and say, hey, do you want to go and schedule your Wellbeing screening with me? And then maybe I'll go get a coffee on campus and walk back together, right? I think that's a really fun way to bring a friend. And so think about that because it's an amazing opportunity to get these numbers checked. And we always say, know your numbers. You can't change something that you haven't measured, right? And so the fact that you can come over and see Carolyn and Sierra and Miranda and get an apple and get a $50 Visa gift card, which I love, and a t-shirt, and you get all of these numbers for free in a really, happy environment outside of, a clinical setting, I think is amazing. So treat it like a little field trip and bring a friend along. But you're going to learn about your heart health, your cholesterol, your blood sugar or blood glucose. You're going to talk about your health risk and you're going to get your blood pressure checked. You're going to know your triglycerides. You'll get your BMI calculated. And then they'll talk about your activity levels. And then you'll talk with, usually it's going to be a nursing student in the fifth semester of nursing school. So students that I teach, you're going to get them, or you might get a medical student, or you might get a nutrition student, just depends on the screening day. But you'll get a student who has been coached and trained to be able to do the screening with you, and then you'll talk about setting goals, plus all of those good freebies that I talked about. And so I do this in addition to going and getting my yearly annual physical exam. So typically, I will go in March or April to Wellbama, and I'll get all of those good rewards and see my friends. And then I usually, at the end of April, will actually go and see my primary medical doctor toward the end of April. And so I know my numbers from my Wellbama screening, and then I can compare those to the numbers that my physician orders, and we can have a good chat about it. Because a lot of times, the way that my doctor's office does it is I won't get my blood work done. I'll get it done the morning of, and I'll see him in the afternoon, but he won't actually have my blood work numbers available to discuss at my appointment that same day. And so if I don't have any issues, then the nurse will call me and they'll tell me my numbers, or they might just say everything's good unless I ask for the specific numbers. And then I won't see my doctor again until the next year. And so what I really like to do is to already kind of have an idea of what those numbers might be. And then that way I can have a good conversation with him and we can chat about it. Otherwise, you're kind of on your own to figure it out unless you go back or unless you get them to put your numbers in the portal or whatever it is. So this is a really great way to have a conversation with your doctor. I know not everyone does that, but I see someone who has a lot of patience, and that is just kind of the way it is at this point. So when you go for your annual physical exam, your healthcare provider might be a nurse practitioner, might be a physician, could be a physician's associate, not typically in Alabama. They're going to screen you for your medical issues, assess for future risk of medical issues based on your history, your family history. They're going to encourage a healthy lifestyle, hopefully, and then you can update any immunizations. And it's also a really helpful thing to build a relationship with your healthcare provider, because you don't want to try to find someone after you've already had an accident, an injury, a diagnosis, because then they don't know you. But if they know you at baseline when you're fairly healthy and you have a life sustaining, kind of situation where you're having a diagnosis or something has come up, then they're able to actually know, okay, well, I know Abby at baseline, and this is Abby in crisis. Like those are two different Abbies usually. Like we all are, right? We don't we don't always stay at baseline when we've had an upsetting event. And so that allows them to better be able to treat you and help you know what you need to do. So that's a great kind of, I think, benefit that we don't often talk about. So, other minimum recommendations, unless your healthcare provider comes up with a different plan for you, which is totally possible. You have an annual physical exam with lab work, a dental exam and cleaning twice a year, a hearing screening every 10 years until age 50, and then every 3 years after that. A lot of times, those hearing screenings actually don't get done. So, that's not something that's often recommended. But if you have a family history of hearing loss like I do, it's super important that you do this to know whether you need hearing aids or if you're safe to drive or do other things. But you can go to an ENT, so an ear, nose, and throat doctor, or that we do have some independent audiology offices. We have UA Speech and Hearing here on campus, and so certainly they take adults from the community and from campus. So you've got lots of options because you work here and because we have the University of Alabama. You need a comprehensive eye exam with pupil dilation, meaning they put those drops in your eyes and you can't really see for a few hours. You need to have that done annually once you start getting to this age. Blood pressure screening annually, cholesterol and diabetes screening annually, which we have a good kind of screener for that at Wellbama with those three: blood pressure, cholesterol, and diabetes. And then a lot of times your physician will order a baseline EKG or a baseline chest x-ray, depending on your level of health. For ours, over 40 with chronic health issues, you usually go ahead and get both. If you're relatively healthy and there's nothing else going on with you, then our doctor's office will say 50. So it just depends on the individual provider, but you can always ask if that's appropriate for you. And then, of course, really every adult should be getting a thyroid check. So this is lab work, but it's also palpation, meaning that they take their fingers and they put them on either side of your neck. They're going to stand behind you and to the side, and they're going to put their fingers here and they're going to press on one side and ask you to swallow, press on the other side and ask you to swallow, and that lets them palpate what looks like a butterfly, but it's your thyroid, and that's kind of the engine of the body to make sure that it's okay, because you can have hyper or hypothyroidism. Hypo means that your thyroid levels are too low, and that really contributes to a lot of hormonal issues. Also makes you feel really tired and feels kind of like you're weak and draggy. Um, but your numbers and your lab work can look pretty good for a long time and you still don't feel great or you don't have optimal blood work. So letting your provider know your symptoms and kind of how you've been feeling and what that looks like for you every day is really, really important so they can check that more frequently. For me, I have to go usually twice a year for blood work because typically when I go in April, I haven't been outside all winter and it's just now starting to get pretty to be outside. And so a lot of times my vitamin D is low. My vitamin D runs low all year. And so usually have to go back in either 3 or 6 months later after my April appointment to actually see has my levels come up or do I need to actually take a supplement. So that's just an example of why you might go back for something more specific related to your health care. Of course, there's immunizations. It's recommended that you get the flu, a tetanus booster if you need it. Once you get to be usually over the age of 60, 65, the pneumococcal to prevent pneumonia, hepatitis as recommended, and then a colorectal screening over the age of 50 unless you're high risk, and then they do it in the early 40s to make sure you don't have colon cancer or polyps, and then every 10 years after. And you also could do a fecal occult blood test or the fecal immunochemical test. There's lots of ones that you can do kind of over the counter now, but I think it's good if you have risk factors or gut health issues to actually see a provider for that. Of course, the mammography or thermography, you can do that starting as early as in your 40s. They've actually changed the recommendations in the last year to say that women as young as 40 need to start doing the mammography. get your mammogram so that you can make sure that you're not at risk. It used to just be higher risk for those in their 40s, but there has been such since 2020 or so, they've noticed an uptick in breast cancer in younger women. So as young as the early 20s, but certainly more common in the early 30s and late 30s. So they've recommended that all women start getting screened in their early 40s now. Of course, prostate exam is very important for men, and you also have the concerns of testicular cancer. So for both men and women, monthly you should be doing a check. So women monthly, if you still have a menstrual cycle, you should do it after your menstrual cycle where you're not so tender, but you should do a self breast exam, and that looks like with the breast. I'm gonna use my sticky notes as my breast tissue, but you're gonna want to do your fingers down in a line like you're mowing a lawn, and then across, and then you're going to want to do circular motions all the way around the breast tissue and go all the way up into your underarm area because you've got breast tissue over there. And you're going to want to use the finger pads of your three fingers here, and you want to make sure that when you do that, you don't lift up because you're going to slide your fingers. Because if you lift up to move your fingers, you could miss a spot. So you're going to do circular all the way around the breast, and you're going to do the lines like you're mowing the grass. And then that should cover all breast tissue. If you feel tenderness, if there's redness, if there's warmth, if there's an uncomfortable spot, if you feel a mass or a lump, it could just be that, it's scar tissue, or it could be a lymph node that's enlarged. That's not uncommon, especially on the left breast. That's more common to see with the lymph nodes, but it's always a great idea to be checked out. In my early 30s, they treat their breast like a clock. So at 3 o'clock, I had what felt like a mass, and that's what it was labeled. And so I had to have an ultrasound. And it was determined after surveilling it for 2 years that it was just an enlarged lymph node, but it was very painful. And because when you do aspirations, meaning you put a needle in and draw out what's in the pocket or the mass or the nodule, um, because that can cause scar tissue, they don't recommend it unless you're really high risk. And my mom had what they called at the time fibrocystic breast disease. Now they just call it fibrocystic breast, meaning that they're really dense, which is common for women under 40. Because of that density, most women do have that. They wait to have the mammograms until after 40, where your breast tissue starts to break down and it becomes less dense. So that's why the recommendation, because mammograms are not that accurate if you're younger and have denser tissue. So they just usually monitor, but ultrasounds usually are like the next go-to with that. So for men, it's very important because you can have testicular cancer. So for men, their hormones don't shift monthly like ours, they shift daily like ours. So every morning is about the same for a man in terms of their hormone levels, but every night it's about the same, right? And so they have more options in terms of they're not going to have to, make that be around a menstrual cycle or something like that. Hey, Miranda, could you mute whoever that is? Thank you. And so doing the testicular exam, you'll do the same technique with your fingers, but you're going to do all of the tissue, and you're just going to palpate to feel if there's any tenderness, there's any masses, there's any redness, there's any warmth, any of those kinds of things. Of course, any pain, or if there's been movement, like if you're looking at the testicles and one has descended more or one has withdrawn more. That can definitely be a signal that there's a problem. Doesn't always mean that it's something really, really serious, but it definitely warrants someone actually looking at that. And so we usually tell people if you're not having a menstrual cycle or you're a man, that you can pick your birthday. So I was born on February 12th. So that means the 12th of every month, you could go and put that on your calendar or whatever your birthday or whatever your favorite day is. And then that way you just know the 12th of every month, I'm going to go and actually do my testicular exam or my breast exam or whatever health check that you need. It's a really great way to remember that. For men, they have higher risk for prostate and other cancers. And so it's really important that you also go see a urologist to have those exams. Typically, they'll give you a personalized kind of plan for that, but they typically do an exam, and a urologist is typically going to be the person that does that exam. So urologists usually take care of things like kidney stones and bladder and all of that, but they also, for men, take care of prostate exams. So of course we encourage, people to stop or at least reduce nicotine and vaping and tobacco products, using fiber in your meals. So when I say full fiber carbohydrate, a carb that's more complex that has a lot of good fiber. It depends on your age, whether you're male, female, lots of other factors of how much fiber, how much protein, all of that that you will need. I always recommend that you go see a registered dietitian nutritionist. We have some great ones here on campus at UNC. We also have the Nourish app that our Blue Cross Blue Shield pays for. I've seen two different RDNs through that program, and you meet via Zoom. They are licensed in the state of Alabama, and that has been really beneficial to me. But there's also calculators that you can go online. The government has a calculator that you can go and put your numbers in, and it tells you what your macros should be. So what's your target for your protein, your target for your fiber, your target for your carbs, all of that, your fat, how many calories, thereabouts you should be consuming. So that's a really helpful thing. And then starting to build muscle and work toward good bone health. There's lots of ways to know about your bone health. The DEXA scan is something that you can do that you can pay out of pocket. Of course, there's a new body in-body scan that the Wellbeing office has, which is a great one to try. Um, but building muscle and working on your bone health is really important because those are going to be key indicators of how well you live and like how well you're able to maintain your health without pain and without injury. So everything that you can do to kind of build muscle and good bone. There's also a new company in Birmingham that works with people 40 and years and older that talks about good bone health. I would have to look. I think they're in Hoover, but it's got osteo in the name. That means bone, and it's I think osteo health maybe. And they do really specific trainings and exercises for people who are at risk. Because even the medications that you can take for good bone health have a lot of inherent risks to them, and so you want to be really careful about that. Bone health is not one of those things that you want to try to kind of, deal with when you have that issue because the medications can be really hard on your body. But calcium is important. Knowing your, micronutrients and vitamin levels are really important for bone health, particularly vitamin D. And I think it's important to supplement for vitamin D, but I think safe, healthy sun exposure is also a huge part in that. So not being afraid of the sun, but respecting the sun. So, getting outside and, not getting sunburned, but getting, 15 to 20 minutes of good sunshine in the early morning can be very, very helpful. So think about that. Some other, considerations as you move forward. Some of these I've already mentioned, but wanted to be able to give you a checklist. You also want to have a clinical breast exam, meaning a healthcare provider does that for you. So my OBGYN does mine. Some healthcare providers like doctors, nurse practitioners will do them at your annual exam. For me and for my doctor, I've just told my GP, my family doctor, that my OBGYN will do that at my annual exam, and he's good with that. Um, Mammograms, pelvic exams, again, that would be OBGYN. Pap smear test, usually it's every 3 years now, unless you've had a positive one. They even have some at-home test kits that you can do now, which is, I think, a great thing. And then bone density test as recommended. That would be the DEXA scan, but there's also some other tests that they can do as well. And then for men, it's the annual testicular exam. So that's with the clinical exam, and then a monthly self-testicular exam, and then the prostate screening, which is that PSA test. So cancer risk and things, again, I mentioned these go up as you age, and it's really about the exposure, the inflammation, the lifestyle. It just starts to take a toll, and the body has less room to be able to compensate. And so it's just good to know, and it's good to have your cancer screenings. We do a really good job at UA of doing our cancer screenings based on the Blue Cross Blue Shield reports. Hormonal changes for women. I'm going to list these here. There are some great webinars that Wellbeing Office has put together for the like just knowing about menopause, knowing about lifestyle changes, diet, that sort of thing. Basically, everything that you know to do to be healthy is going to help your hormonal health. But it's really wanting to kind of call attention to if you don't feel great and you're over 40, definitely look at your hormonal health first and see if something with that has changed, and make sure that you're communicating your symptoms and your concerns to your provider so that they can make that connection. Same thing with men. Men lose testosterone. It drops about 1 to 3% a year beginning at age 40. And testosterone, like the female hormones, it's not just about being able, to have a good sexual health. It's not just about being able to, give birth and have babies. It's much more about your overall vitality, right? Men who have low testosterone, just like women who have, declining estrogen, lose a lot of their luster, their zest. They aren't as energetic. Their skin looks more dry and is dull. They don't have as much energy. They're not sleeping as well. Their hair starts to kind of get dull and fall out. Like, you can have memory issues and brain fog. That's not just because you're getting older, it's because your hormones are changing. You can have anemia, you can have fatigue, mood changes, you can have all sorts of things, right? And it can look like depression, it can look like midlife crisis, but it may just be hormonal. So really important to know that. Weight changes as we age. We have decreased ability to digest our food, decreased metabolism. Our cells in our body start to grow at a lower rate. Our lifestyle changes. We may be sitting more, and then we typically have weight loss resistance because of those hormonal factors. This is just a general chart of where you might look in terms of weight loss based on how much you weigh, your resting calories, your activity level. This is just a benchmark. I don't think this is a gold standard, but it's good to have the information. And this is something that you would go over in more detail with an RDN. So some healthy strategies. These are some tips just to get started. So do your wellness checks, right? Know your numbers. Have a good attitude, because honestly, like, sometimes all you have is a good attitude. I told one of my best friends, I said, sometimes the only thing that I have going for me is I have a good attitude and I've never smoked cigarettes. I was like, those are sometimes the only two things I can think of when I'm looking for a positive, silver lining in the situation. And it just always makes us giggle. Because sometimes that is all you have, right? You've got a positive attitude and like one win. But that's enough. As long as you've got good community, a positive attitude, you can kind of get through everything you need to get through. We've gotten through everything we needed to get through so far. So we're doing pretty good. But sleep, really prioritizing that, making sure we're shutting off like all the lights, keeping it cool, dark, and quiet in the room. Powering down before bed, an hour before bed, turning out, all of the electronic devices and all of that. Exercising is the number one indicator that you're going to live a long, healthy, happy life in terms of metrics. Connection and community is the overall one, but in terms of actually doing something that's like a health practice, the health practice would be exercise. So having a good community, a good group of friends, and exercising are going to be the two things that help you get to a long, healthy, happy life. Eating more healthy foods, so less processed, like we mentioned. Drinking more water, especially with electrolytes, can be very helpful. Um, Good financial health. In the US, the number one reason for bankruptcy has historically been health issues, has been health crises and mismanagement of finances. And so, um, people will say, well, do we have a financial crisis in the US or do we have a health crisis? And really it's both, because they go hand in hand. But it's really difficult to do what you need to do, to go to all these appointments and, get all of the tools and do all of the things you need to do as an adult if your finances are not in order. And it's really hard. I asked a therapist at one point, I said, is it better to focus on your health or your finances first? Like, what would be the one thing that would make life better, right? Because a lot of times when you're having health issues, you're also having financial issues, and it feels like is it the chicken or the egg? Like, how do you know which one you need to work on first? And her sage advice was just, where is the pain point? Like, where can you see a quick win first? Is it your health or is it your finances? And a lot of times it's your finances, because you can have more control over your finances. Just like I can control how much I drink in terms of water, more so than I can control the quality or even quantity of sleep that I'm going to get tonight, right? And so kind of think about what you can control, and where you can control something, do the baby step today for that. Maintaining a good, healthy sexual health and sex life is really important. That's been linked to longevity. Confronting yourself. This article says confronting vices. I don't know that I love that, but if you've ever read anything about Marie Kondo, from Japan, her KonMari method, which is an organizational and decluttering method, talks about to declutter is to confront yourself. And it's so true. Like, how are we showing up and confronting ourselves and the things that we need to do and the things that we've delayed? Because declutter, the clutter is, kind of undone decisions. You've just delayed decisions. And so confronting those things where we know we need to make better choices is really helpful. And then of course, meditation. I feel like meditation is always the answer. So these are the wellness basics. We have an archived webinar on the wellness basics, and it goes into more detail, but this is here for you guys to refer back to. And some overcoming changes of weight management. So things that you can do to help with that. This is just kind of a little checklist. Exercise, we usually say about 150 minutes of exercise a week is the gold standard, where you're a little bit breathless. You can have a conversation, but you're getting a little bit winded as you do. That's about the moderate intensity that you need. And then walking, I think walking is my favorite thing to tell people to do when you don't know what else to do. Just walk. As long as you have a comfortable pair of shoes, just walk. And then there's some other things here. Knowing yourself, pacing yourself, stretching. You definitely can have injuries from just walking, but you want to make sure that you're well prepared and talk to your provider. There's some more tips here for staying fit. Some other healthy habits to choose from. My favorite is the one I highlighted here. Remember that the best is yet to come, because it is. The best is always yet to come. And then there's some other considerations, like I mentioned, the caring generation, the sandwich generation. So a nice little poem about the in-between that you're in. Pain management. So rest, ice, compression, and elevation therapy, plus over-the-counter. And then after a week, if you still are having pain, it's time to see somebody. I love physical therapy and occupational therapy and chiropractic care. I don't think we do enough of that. Massage therapy is another great one. Taking care of your inflammation. Eye health. These are some other things you can do. Sun exposure. 10 to 2 are going to be the times where you want to be very, very careful about your skin and your sun protection. This is how you know how to check your molds. Lots of great information out there on how to do that. Shingles, our risk factor goes up. So there's a vaccine that you can take for prevention of shingles. You can get this even if you had the chickenpox vaccine, which most of us did not, I'm sure. And even if you've had chickenpox, you can get this. And that's what it looks like. It's usually on the back, right where, for women, right where a bra would be, on the front and the back. I had a colleague that had shingles years ago, and she's like, "Look at my back." And I lifted her shirt. I said, "You have shingles. I'm so sorry." And you don't want to touch them. And I definitely did. But always wash your hands if you see a rash like that. And then mental health, of course. It's always important to get help if you have mental health concerns. And we have lots of great resources through our EPA or EAP. And then habit change, just take one small step. Slow progress is still progress. Here's some other recommended webinars. We'd love for you to give us a follow. I know we're at our time, but if there are any questions, I'm happy to take those. Brenda, did you see any?